Hey, StoneWater Family, Pastor Jeremy here, and I wanted to come to you today because if you remember yesterday at our church services, one of the things I said was during times of uncertainty, we just take the next wise step. And this morning, I met with key leadership of our church and some leaders in the city, as well as some physicians, and we discussed, hey, what's the next wise step for us to take as a church when it comes to gathering together for our weekly worship services. And after we discussed and heard from experts and also looked at the CDC and their recommendations, we feel like that as a church, the best way to fulfill our mission and love the community well is for us to move towards online services. So this Sunday, we're going to start online services, and we're going to have a great and amazing online worship experience. We feel like this is a great way that we can love our community, that we can love our neighbors, that we observe the social distancing that CDC is recommending, and that we move forward with this as a church. You know, our mission as a church is to reach and equip people for Jesus. The mission always stays the same. Now, our method of fulfilling that mission may change, and it's changing over the next few weeks. Our plan is to follow CDC. They say 8 weeks, so 6 to 8 weeks is what we're planning for. Now, we're always open to changing that plan along the way. If God throws a curveball and heals the nation and cleanses this coronavirus, then hey, we're going to be meeting immediately. But right now, we feel like it's wise for us to plan for the next 8 weeks out. Now, I know there's some people that kind of on two different sides of the spectrum. Others say, hey, probably should have done this earlier. And then there are some that say, hey, you may be overreacting. I don't know which side of the spectrum you're on, but I wanted you to hear, church, from an expert. Okay, this is a friend of mine. This is Jarrett Grace, Dr. Jarrett Grace. All right, I never call you doctor.
No, you don't have to.
Okay, so Jarrett and I went to school together. We went to high school together, and we also served together at Elevate. And he's a member of our church family. And Jarrett, you and your wife both work in the medical field. And I just want to, would you just share a little bit? Is this a wise decision that we're making?
Sure, Jeremy. It is. I think over the last few days I read a quote that said, everything we do before a pandemic will seem alarmist, and everything we do after will seem inadequate. So I guess just to back up a little bit, we're going to be asked to do some really hard things that seem either over the top or overreactive. And I've heard the word conspiracy used, and that all makes sense because we've never experienced anything like this in our lifetime.
We've never had anything like this.
No. This is once in a generation. It's something we're likely, hopefully, not to see anytime soon again. But because of that, because it's so unique, I think we've got to heed the advice of the experts on this, and know that they still don't know a lot of things. They're still trying to figure it out on the fly too. It's a new virus that appears to be highly infectious, and a lot of people walk around without any symptoms for a while. And because of that creates a perfect storm for spreading it very easily. And because we can spread it so easy, it just makes sense that the one way we can decrease the chance of infecting other people is just by keeping our distance.
Yeah. So Jared, I've of course I probably watched social media just like everybody else, and I've seen the different graphs, and it help me with this. Like we're basically trying to slow down the spread of this disease. Is that correct?
That's correct. So if we look at something that we're all familiar with, such as the flu spreads from September to April. So you talk about 8 months where you have a high number of infections, but they're spread out over time. With this virus that is so contagious, although it doesn't cause a lot of people to get sick and have symptoms, there's so many people, percentages are going to cause a lot of hospital admissions, and all those are going to happen over weeks, if not a month. And because of that, we're just at risk for overwhelming the resources we have. And where that concerns most people that they don't think about is, for common medical problems that normally we can get treatment, whether it's appendicitis or heart attacks or strokes, we just aren't going to have the resources to take care of those like we normally would. So to flatten that curve means that we may not decrease the number of cases totally over the course of over the next year, but at least we'll spread them out and make it easier to treat.
Yeah. So Jared, when you look at the measures that we're taking as a church, is this wise? Is this what's your thoughts?
I think it is wise. I think at this point, with not knowing who's infected, with tests just now kind of coming out and becoming more available, we just kind of assumed that there's people in our community that probably would test positive, that maybe just don't have symptoms, and we just want to do our best to not infect others and pass it on, knowing that for majority of people they would be okay, but for those that are at higher risk, whether it be the older folks, the people with pre-existing health problems, we can do our part to protect them by just keeping our distance from them as well.
Yeah, thank you, Jared. You know, church family, this is just a great way for us to show love towards other people. So I just want to encourage you to continue to do that. I also want to say this, that we have a team right now that's looking at, hey, what are new ways that we can perform care for our church, for you? And then what are ways that we can leverage this crisis for Christ? What are ways that we can go and meet needs in the community in a practical way? So just want you to know that if you're watching, if there's something at all that you need, please let us know. We're your church family, and we want to be here for you. Guys, thank you. Be in prayer. Be watching social media. We'll have updates daily. Thank you.